This is Brandy Brimhall, and I'm going to be presenting the professional use of social media for your practice. So think before you tweet, and all of the guidelines in place and general recommendations that we have for our practices and for healthcare in general to help us use social media productively and professionally. Before we get started, to quickly introduce myself, my name is Brandy Brimhall. I'm a certified professional coder, certified medical compliance officer, certified ChiroCode chiropractic professional coder, certified professional compliance officer, and a certified professional medical auditor. As we begin with use of social media, I want to just first start off by reminding everyone that the internet is the largest provider of information that we share. So truly, anything can be shared anywhere. It can be reshared, snipped. There's really no limit to the type of communication, the length of communication, the content, the subject, anything like that when it comes to social media. While this is a tremendous advantage to our practices if used properly, it certainly can be a tremendous risk to our practices and ourselves individually if used improperly. So we want to get started just by making sure that we set some of the foundation for the social media platform, understand what that is, how it works, and then begin to look at the systems, policies, and procedures that we need to consider in implementing into our practices and personal use to best protect ourselves. As we begin, I want to share with you a statement that I read some time ago. It says, social media networking has a great benefit of creating a ripple effect that allows people or businesses to share insights, information, and to communicate in general. If inappropriate, unethical, unprofessional, or unauthorized information is shared, this ripple effect works exactly the same. Not only can it be harmful to others, it can, and it will, also directly reflect you or your business. Now, this is a pretty profound statement that many of us have already probably seen or heard of some person or company experiencing, not even necessarily in healthcare, although that's happened as well. But keep in mind of what you see on social media, what perhaps you hear on the news, or what you're reading on your front page of Yahoo or Google or different places like that, as far as how people or companies are using social media and the potential ramifications when that's used improperly. If this is the only nugget that you take from the webinar today, this would definitely be an important one to take back to your team and discuss. That'll help you hopefully decide how and what type of content to include on your professional social media sites, but also how to use your personal social media sites more productively and more professionally as well. And we'll get into more of that as we move forward. The next thing I want to share with you, especially for those that maybe haven't quite put your toes in the water with social media yet and aren't really sure what to think of it, I want to share with you what social media really is. So we're going to go ahead and define that. So as we move through the next several slides, you'll be able to relate that discussion to these social media platforms and many others. So social media is generically defined as internet-based applications that allow creation and exchange of user-generated content. Common examples of social media that you might be familiar with or maybe even using yourself could be Facebook, MySpace, blogs and websites, Twitter, Instagram, YouTube, LinkedIn, and the list is long and distinguished there beyond that. So really anywhere that you can put new content, update fresh content, doesn't matter the length or type of content, all of these types of things are considered social media, and many of them are platforms that we either use personally or we use for our businesses. So what do people use social media for? And the list, again, long and distinguished of what social media is used for. There really are no limitations to what we can do with social media. There's a lot of content that's exchanged, a lot of discussion that's exchanged with social media. So just those buzzwords that I have there on the screen for you to see are just but a few of the ways that social media is used by the general public. With that being said, keyboard confidence is a popular thing nowadays, whereas a lot of people or organizations will post onto social media what they may not share openly, and this is certainly an area of increased risk for everyone across the board who does that type of communicating. So we'll get again more into that, but social media can be used for really anything and everything. when it comes to healthcare, this is where we really need to do our comparing and contrasting and understand the drastic differences in these two industries. Now, while they are two totally different industries, we would expect there to be some pretty drastic differences anyway. However, healthcare is an industry that has established very clear boundaries, whereas social media is really the exact opposite. Because these two industries can work together or can network together, one of them can use another, in other words, we need to make sure that we really understand the comparison and contrast of these industries so that we can, again, understand how best to use it in our own, which is healthcare. So first, healthcare requires limitations of risk. So we know the compliance rules. We know that we're always making a good faith effort, or should be making a good faith effort within our practices to limit the risk of our practices, of our licenses, of our professional reputation, versus social media is a very risk-taking industry. So there's a lot of content and information posted and shared. Again, that keyboard confidence has caused trouble for lots and lots of individuals who like to sit at their keyboard or have their thumbs going and responding to posts or making posts that may potentially be controversial or offensive and various of things like that. Healthcare also provides information. Of course, all of our information that we provide and that we review in healthcare for our treatment, for everything that we're recommending for our patients, relies very heavily on confirmed resources. So in the healthcare magazines, even the ones that I write in for the topics that I write on coding and compliance, you have to have sources and resources for all of the information that you're sharing. All of healthcare relies upon that, be it new instruments or devices that's being implemented, new types of treatment and findings. Again, the coding and compliance related topics, we have to have sources and resources to really confirm and validate the information that we're sharing. Social media really is the polar opposite of this, because facts can be difficult to decipher. Lots of social media is opinion-based, and it is difficult to see where information is coming from. Lots of information can be misconstrued, snipped and only used partially, or completely taken out of context. Next, healthcare is very privacy and security regulated. So this is all of that compliance umbrella that we hear about all the time for our practices. Social media, again, has very limited regulation, and really anyone can publish anything they want, almost anywhere they want on social media. So again, pretty drastic difference there. And then finally, healthcare relies on very controlled and preserved data. All of our research and information for, again, treatment, devices, instruments, coding, billing, all of those topics that we rely on gathering information from in healthcare and that we need information on has to be very controlled and preserved. Some of them are very aged studies that we're looking back upon on the history of those types of things. Social media, alternatively, information, as I've mentioned, can be copied, can be shared, can be snipped, can be taken out of context and plugged into a different environment, and which ultimately results in changing the complete meaning or complete purpose of information that was shared. So while these are very drastic differences, again, setting the foundation for how to use that within our practices, I find it important to really realize how different these two industries are. Healthcare is very well reined and has very short reins, whereas social media, the reins are off and the horses are running, so to speak. So making sure that we just understand these and understand the risks of social media in healthcare. Again, just to remind everyone, I'm not advocating at all for practices or professionals not using social media. I think social media is fantastic. I use social media. It's just that it has to be used professionally. There has to be some standard of practice for use of social media and a good solid purpose why you're sharing the content that you're sharing, and making sure that you are in compliance with the many guidelines that we have in healthcare, so that we are within those types of boundaries and maximizing our use of social media rather than increasing our risk in social media. So some of the concerns in healthcare include, of course, first and foremost, is HIPAA and that protected health information of patients. There are 18 protected health identifiers, and oftentimes those end up on social media, Facebook pages, Instagram pages, Twitter feeds, various of places like that, websites, and the list goes on. So we have to make sure that we understand what the protected health information is, what the HIPAA guidelines are, and make sure that we're honoring those anytime we're using social media for our practices, or personally for those that like to post work-related information on personal pages. Next, you need to be concerned of professional versus private online presence. In fact, it's recommended by many state boards and state associations that doctors actually have a separate social media presence. So you have your practice social media page, and then you have your private and personal, but that these two should not blend together because it could definitely misrepresent your relationship with some patients. It could be misinforming and could definitely be potentially damaging to a personal reputation as well as a professional reputation. I'll give you some examples as we move on. Next, another concern, as you might imagine, is the appropriate use of social media, and that's going to really be a lot of what we go through today, because while there, again, as I've mentioned, there aren't really strict guidelines for how to use social media, there are ways to use social media where it's effective and beneficial to your practice versus the exact opposite, which is increasing your risk and vulnerability. Next, some concerns include access to social media on healthcare or hospital networks, and so making sure for those practices that have social media access on the same computer or workstation that you can access your billing records, patient documentation, your practice software is definitely something to be concerned of. This takes us down the pathway of HIPAA security and making sure that first and foremost that we are securely using those pages and those sites so that there isn't a risk of viruses and worms or hacking onto our sites, but also that we're maximizing our workforce time during the day when they should be working and not on social media. Again, we'll go through all of these in greater detail as we progress. Professional guidelines and company policies is another concern. It's recommended, of course, that you have a company policy on how social media can and should be used for your facility. So this is something we're going to go through. I'm going to give you several tips and strategies on how to do that, as well as content to include into your social media policy. Having been a CA myself for a good number of years, I would tell you that it is difficult as a CA and as doctors, if you don't have a policy well defined or defined at all for your facility, no one has any other option but to guess or assume. We want to make sure that we remove that piece completely when it comes to social media for our practices, so we make sure that we have a well documented, written, and trained social media policy for your practice. Next, we have uncertainty and boundaries, and this goes to the point that I was just making a moment ago. When there's uncertainty, the only thing anyone can do is guess or assume. Oftentimes, that ends up being an incorrect guess or assumption. Also, of course, we have the obstacle where there's just certain things that are posted onto social media that perhaps without training, that person or people that are posting specific content just simply doesn't know better. And this is your responsibility as doctors, as practice managers, to make sure that you have this again in writing and are communicating it properly to your entire workforce. Something that I find to be really interesting is the question that I would pose to you is who really monitors social content? Well, when it comes to all of our social media sites that we just discussed a few slides past, the monitoring of this is extremely limited, and really, by and large, most industries can post just about anything without having any obstacles at all as far as that level of monitoring goes. What we need to make sure because of that is to limit our risk and make sure that we have someone internally within our practices monitoring our social content. This means if your practice has a Facebook page and you're posting regularly onto your Facebook page, who has access to that? who's allowed to make the posts, what are the topics of posting that can be done or that are prohibited for your practice, and who cycles through that. Is it a doctor? Is it a compliance officer? Is it your practice manager? Who is it that has the appropriate training and knowledge to just be sure to review the content to make sure that it is correct? So make sure that it's correct, compliant, that it's not breaking any rules or crossing over any boundaries or perhaps misrepresenting anything for your practice. So make sure that you have that in place for your practice. Some social media statistics I wanted to share with you that I find to be extremely interesting. This actually comes down according to the Federation of State Medical Boards. So this is medical boards all across the country. They say that an estimated 87% of medical providers use some level of social media for personal use. 87% and counting, by the way. Next, an estimated 67% and growing of medical providers use social media for professional use. Research indicates that 35% of practicing physicians have received personal friend requests from a patient or a member of the patient's family. This is significant because we have the opportunity here, or rather the unfortunate opportunity, I should say, of getting the patients too involved with our personal lives and perhaps misinterpreting the relationship between the doctor and the patient, or perhaps finding that there's something about their doctor that they just don't really agree with, just don't really like, and therefore it affects the provider's professional reputation, even though it shouldn't. So the first and foremost thing, and again I'll repeat this later because it's very important, doctors and CAs or medical staff should never reach out and friend your patients. You can, if your patients friend you, this is something that you need to consider as part of your policy. Overall, it's generally recommended that unless you have a good reason to allow that Facebook friend or follow on Facebook or social media, that you aren't doing that simply to avoid the chance of increasing your vulnerability by misinterpreting the relationship, as I mentioned, sharing something, and perhaps it's a photo, perhaps an opinion, perhaps it's an experience that could be a negative impact to your patient's impression of you as an individual or as a professional. The next is an analysis of physician blogs revealed that about 17% of those blogs included enough information to identify patients. This brings me to an important point. I truly believe that 17% is much higher than when I pulled these stats about a year and a half or 2 years ago, is when these were most recently released. The reason for that is just last week, and I struggled to not post it onto the page here to share with you today, but there's a practice that is local to me actually that had shared something on Facebook, and I don't know if I must follow the, actually no, it was a sponsored site, so it's an ad that they posted, it's sponsored through Facebook, so they pay to post this. Has pictures of the chiropractors, there's 2 chiropractors with 2 patients laying on the treatment tables getting adjusted. You can see who the patients are, you can see their faces, all of those different types of things. This is something that we shouldn't do. I'll explain more as we go on, as I have specific slides for this, but this is identifying information, certainly to have a photo of a patient. And where it's on a sponsored ad, this means that that is going out to thousands and thousands of people with no ability whatsoever for those providers to limit where those pictures end up, how they're used, if they're snipped, if they're shared, any of those types of things. So please don't do that on sponsored ads for Facebook or anywhere else. It's a risk to your patients, it's a risk to your practice, and simply just isn't worth it. There's other ways to go about letting patients know, or potential patients know, who you are and what you do for them. Next, there's a medical board survey, and this was a 2010 board survey, reveals that 92% of medical boards indicated that violations of online professionalism have been reported within their jurisdiction. So this is almost every single state board. Most of these resulted in disciplinary actions, and this included, so in response to these violations, 71% of boards held formal disciplinary proceedings. 40% of these boards issued informal warnings, so just a written warning that was sent out to the provider or the practice. And the outcomes of these included 44% were license limitation, which is really significant. 29% was license suspension, and 21%, which is also extremely significant, is a revocation of licensure completely. So keep in mind, this isn't chiropractic specifically, this is a medical board survey, so this is all encompassing, but these are really big numbers, and they're really alarming numbers, and they continue to increase and grow simply because practices, hospitals, medical industries in general just simply don't have clear boundaries and policies and procedures when it comes to their use of social media. So there are some common medical board sanctions I want to share with you. So this is ultimately, for those that I had mentioned on the previous slide that there were sanctions, this is what those sanctions were. So keep in mind first that your medical boards or chiropractic boards do have the authority to discipline doctors for unprofessional behavior relating to inappropriate use of social media. This includes inappropriate communication with patients online or employees, inappropriate use of the internet for unprofessional behavior, online misrepresentation of credentials, which I've known this to happen a few times, and there are some pretty healthy fines that come down from that. Next, online violations of patient confidentiality. This is the HIPAA piece that we've discussed a few moments ago. Next, we have the failure to reveal conflicts of interest online. So this could perhaps take us down the path of the Stark Law and things of that nature. Next is online derogatory remarks regarding a patient. Next, online depiction of intoxication. This is where I'm saying also that allowing your patients to friend you on Facebook or reaching out to friend them is an increase of risk to you, because even though you probably as the doctor or as the CA or medical assistant, whatever your professional title is, perhaps are looking at that as this is my personal social media. However, if patients are able to see this, or potential patients are able to see this, this could have a very long-term, long-lasting impact on your professional reputation. Your personal reputation could impact your ability to get a job when you move, or even if you aren't moving and you're just changing jobs. And so often these types of things come to haunt someone years later, long after they've forgotten about it and it's a complete non-issue to them. It comes and sneaks up on them again later. So remember, anything that's online is online, it's there, and it's permanent, and we have very limited ability to control who can see it, how it can be shared, if it can be copied, all of those types of things. In fact, our control is so limited it's almost to zero. Also, other sanctions include discriminatory languages or practices online. And as mentioned already, disciplinary actions can include anything from simple letter of reprimand all the way up to license revocation. So coming down from the Federation of State Medical Boards, they do have some guidelines for us, and they encourage practices to have written and reviewed policies to accomplish the protection and privacy and confidentiality of your patients, to avoid requests for online medical advice. Keep in mind, you may be asked to cross a Facebook thread, perhaps it's a private message, maybe it's across the email. The patient or potential patient gives you the spiel of what their conditions, complaints, symptoms are, wants to know what to do. Patients really like to self-diagnose, and with that being said, it's really easy to abbreviate or to type in a short summary to them of what could possibly be the recommendations or could possibly be the findings, which leads the patients to assuming, to misunderstanding, or to perhaps interpreting that you're giving them medical advice that you just simply aren't doing. So have a standard language that you use, letting patients know when they do ask those types of questions across social media that either the doctors aren't answering it, or you're just simply saying, have a canned answer, letting the patients know or potential patients know that they would really need to have their complete history completed and be evaluated before comprehensive medical recommendations or findings could be discussed with them. So make sure that you have something like that rather than take the chance of giving information that could be misconstrued. Next, make sure that you're acting with professionalism on personal sites as well as professional sites, and we'll get into the personal side just a little bit later, but anything that you're posting, make sure that it is professional and can be viewed by any audience, because remember also on social media you can't control the age or type of your audience. Next, be forthcoming about employment, credentials, and conflicts of interest. So as a DC, you need to make sure that this is listed in your Facebook page, that this is as far as your professional page. Make sure that it's clear what type of facility that you have. Even your state guidelines pulled down from every single state across our country has advertising recommendations, and pretty much every one of them, if not every one of them, requires that practices and providers are clear about the credentials that they have. This applies for all types of advertising, and certainly social media, be it websites, Facebook pages, Twitter pages, whatever, requires is some sort of advertising. So you need to make sure that your credentials are clear. Next, you need to be aware that information posted online may be available to anyone and could be misconstrued. I mentioned that already, but definitely worth re-pointing out, because again, I come upon it all the time, and I'm sure that many of you do as well. So there are some methods of using social media because it is part of our daily life. We have our email, websites, and online organizations that we interact with, our computer or cell phone applications, multiple downloadable apps on our cell phone, and of course texting is a form of social media as well. However, with all of that being said, there are some pros and cons to social media. So let's really get started with the benefits, because there are a lot of benefits for social media with professional use when we use it properly. It can be an excellent tool for marketing because, again, you can reach an audience that's far and wide. Simply seeing business profiles helps to keep businesses in the forefront of a patient's mind. This is why those sponsored ads are so popular, why being on Facebook and having fresh content is so popular, and not just Facebook, but it could be Instagram or Twitter or other social media sites that perhaps you find beneficial to your practice. It also is great for recruitment, so perhaps not just new patients, of course, because you are able to share information or tidbits on a variety of topics that your practice may treat. Maybe it's athletes, or maybe it's children or families, whatever the case may be. You have the ability to use buzzwords and hot topics of information, articles, various of things like that to share on your social media pages to educate patients and or potential patients and recruit them to your practice. But practices also sometimes use social media to recruit new staff members when they are searching for new doctors, new front desk CAs, new billers, and those types of things. It's helpful in spreading the word to far and wide, again, for things like a change in your office hours, holiday or weather closures, perhaps a new practice location or a practice expansion, crisis communication. If there's something going on, social media is the place that everyone goes to look to see what's going on, and this is likely the first place that many of your patients or potential patients, certainly your community, will be able to see what's going on with your practice, why, where, and those types of things. So excellent tool for that, rather than the old, what would be a caveman way that we used to have to do, which is being on the phone all the time, sending out letters and postcards and things like that. Social media is really the hub that allows us to do a lot more, a lot faster when it's used properly. Some additional benefits include increase of transparency. So this really helps patients and potential patients to learn more about you and about your business, and it helps to build your brand and to promote your brand. It's excellent for promoting current events and new services that you may be providing, and it's great for educating consumers, so potential patients or your existing patients. Make sure that you understand the limits to this, because again, we want to educate with useful information that makes people want to come into our practice or want to reach out to us because they know that we know and they know that we can help them. However, we want to make sure that we're not sharing information that could be misconstrued as medical advice or could be potentially communicating to patients that we are of a different specialty than we are. We don't want to give them misrepresentation that we're a different type of provider than we are. So keeping that in mind, you can use this as a fantastic educational tool. Some additional benefits, we're able to provide our own content. I know with websites, especially when websites became the thing that just everyone needed, the next thing that came behind that was organizations that created your newsletters and would email your newsletters or would put information up on your website for you. But with social media and with it being so versatile and so flexible and so at our fingertips, we're actually able to create content that's specific to us, specific to our practice, and communicates fits with our demographics, with what we want to share with people. Perhaps it's the conditions that we have patients coming in within our practice. Perhaps it's the tools and services that we use within our practice. So it's much more specific and customized, being as flexible as it is. So we can also increase and improve our focused and target marketing and the education with that. Community outreach can be fabulous when social media is used properly. This really allows you to build a virtual community based on patient needs and your own practice focus and interest. Lots of practices or providers go to YouTube, podcasting, and various of things like that so that their patients can hear straight from them. This has been a phenomenal tool for many practices that I know of, but again, we've got to make sure that we're using it properly. And of course, it allows for ease of communication with patients and peers. And again, a big snowstorm comes to Colorado, where I'm located. Practices would very commonly go to their social media and post their closure. In fact, I just saw this last week with a closure that we had due to a big snowstorm here in Denver not long ago. So again, easy way to communicate that prevents you from having to spend a lot of time on the phone reaching out to everyone. You can maximize social media in a number of ways, and we're going to go ahead and cover that. First, as I've mentioned already, you need to make sure you know who's responsible for managing the practice social media. And it's important for owners and doctors to understand how and why social media is being used. It's really important to understand that attraction to the social media sites and just your presence on social media sites really does thrive on fresh data. So my suggestion to you is, if you're not updating data regularly, you're probably wasting your time. Meaning, if you only post to your Facebook once every month or two, chances are the day that you post it, you're seen by a few people that happen to be past the page, but by the next day or the following day, that post is aged. You need to have some fresh data. So you want to make sure that you have a system in place to keep your data fresh. Doesn't mean you need to be posting multiple times a day, but it means you do need to have somewhat of a consistent schedule for posting on social media, really in order to be able to be in a position to maximize it. Social media posts do have a shelf life, and while they can be found by searching or scrolling through social media sites, again, it's harder to find these types of things if they're buried down in the history of social media. But those are the types of things that can creep up on people and companies when social media isn't used properly. Use of keywords or buzzwords for social media is excellent, because people search by using the keywords and buzzwords, the hot topics that come to their mind or that they're learning about. Social media, I think it's really important just to remind everyone, social media is not intended to give complete descriptions, but that's why buzzwords and keywords are so important. This is why our Twitter only allows so many characters before it completely cuts out and we're not allowed to, or not able to add any more content. So social media is intended to be, right now, it's a hot topic, it's a buzzword, a bit of information to share, perhaps a link to an article to share, something like that, but it's not intended for full-fledged conversations and discussion. This is reserved to more person-to-person evaluation and other standard types of communication. Next, you can use pictures and videos along with text. Pictures and videos are always helpful. This is why so many providers now like to go to podcasting and YouTube to share information, share something they've learned, or share insight or education that they've recently gotten on social media, because pictures and videos are a pretty phenomenal way of letting everyone know you, letting them listen to you, and promoting your brand. With that being said, though, you do have to be cautious with pictures and videos, because if you are crossing any particular compliance-related boundaries, such as revealing patient identities, that's going to be a risk to yourself and your practice. One thing that practices should do is identify your purpose for using social media. I think this is really helpful, because so many practices that I've actually asked this particular question to aren't really sure why they're using social media. They just know it's something that they decided to jump on board with some time ago and kind of come and go from it, but don't really have a clear path. I think it's important to have a clear path for social media, because this is going to help you really decide your path forward and what kind of content you're going to be putting into your social media, perhaps your social media posting schedule, and it's going to be great for establishing the structure and boundaries for social media use for your practice. So if you only want to increase practice visibility in your local community, you'd want to use those types of tools that would allow you to do that. So events you're attending, events you're having, your office hours, introducing the products and supplies you may be selling for your practice. I've known many of practices who do a lot of nutrition, and one of the things that they do is introduce a new product from their social media page, not giving advice, but rather giving educational bullet points on particular products. And it's beneficial in helping patients that are seeing those social media pages coming in and beginning to ask questions. So it's helpful to the practice. There's lots of different ways that this can be done to increase practice visibility. You could also advertise new services or changes to your practice and then save money in any manual mailings that you may be doing. This is an advertising tool, so again, as a reminder, if this is how you're going to be using social media, the very first thing you should do after setting up your social media page, or perhaps even right before setting up your social media pages, is go to your state guidelines and look at your advertising guidelines for your state. You want to make sure that you're consistent with those. Next, what avenues of social media would be most productive to your practice? So an example, LinkedIn is a really popular social media page, but this is really more for professional networking. If you're wanting to professionally network, LinkedIn may be just for you. However, if you're wanting to use this as an advertising and marketing and educational tool, you're not likely to find nearby patients or potential patients through the LinkedIn network as well as you would through places like Facebook and other social media sites that are more designed and geared to communicating with a different type of demographic or with a different type of community, because Facebook, of course, can be very directed toward a very specific community. Next, some boundaries with social media that every practice should consider. I've mentioned already, and again, want to just continue to reiterate that you should have an office policy if you are on social media as a business. Your office policy should contain specific social media guidelines, and definitely if you have a pencil and paper in front of you today, I'm going to be going through some of those guidelines with you to help you bullet point what should be included or what to at least consider including in your social media policy. The first thing is, in your policy, you want to make sure that you're not allowing social media to become a distraction from your daily responsibilities. And so decide when and how frequently social media is going to be posted, the types of posts, so someone isn't sitting on your Facebook page for 15 minutes trying to think of something, but have some kind of plan. You want to make sure that you're maximizing your time and you're using social media to its maximum, but also not delaying staff time by trying to decide what to do, when to do it, or spending too much time on your business social media pages. Next, personal social media and practice social media should be carefully considered. For doctors, it's absolutely recommended that your practice and your personal social media pages are not the same. So avoid dual use, but business needs to be business, personal needs to be personal. Again, just to say, I don't want to be a scare tactic for you today. I think social media is fantastic and lots of doctors are on it personally and professionally. If it's working well for you, fantastic. Just make sure that you're staying within those guidelines and protecting yourself, protecting your patients, and protecting your business. I mentioned already that this could create an unreasonable expectation that doctors will reply to questions and comments. If this is something that happens and you are the doctor and you're fine with that, just make sure that you, again, limit your time so you're not spending too much time on social media, and have some kind of canned or prepared responses so you don't find yourself in an ongoing back and forth with a patient or potential patient when they really need to be in front of you in your office to be evaluated and providing you with the traditional standard information that's required in order to give recommendations. On the same token, we don't want to miscommunicate the relationship and be available too frequently to our patients where they may think that we're constantly right there at their fingertips, and perhaps they go past the provider-patient relationship and it goes into more of the friend zone or in other inappropriate areas in those relationships. The American Medical Association has issued an ethical opinion on the matter as well, and they say, actually theirs was developed in November of 2010. They have gone on to recognize the many benefits of social media, most of which I've already covered with you on the previous slides. And they also go on to advise practices to understand the boundaries prior to maintaining an online presence. So all of these things that we're talking about today. The AMA goes on to say, physicians must remain cognizant of patient privacy and confidentiality standards. Keep in mind that every single opinion or guidance piece that comes out regarding social media, the very top one is always patient privacy. So this has to be of utmost importance to you. Identifiable patient information must not be posted, and this is according to that AMA ethical opinion. Physicians need to understand that social media privacy settings are not absolute. I hear this from time to time. Oh, well, I have a personal page, but I have privacy settings onto that. Make sure that you look at your privacy settings to see how those are set up first. But next, keep in mind, your pictures, your posts can be copied, shared, reposted. It's crazy the places that information has ended up in that was never intended or expected. So just be aware of that. Once information is posted online, keep in mind as well, it is there permanently. And again, you don't know where all it may have ended up by the time you posted it to the time you deleted it. Doctors are encouraged to monitor their own online presence to ensure that the information is accurate and professional. Many doctors just simply don't have the time or perhaps the interest to do this as far as the business goes, which is fine, but this is why you use that tool of the office policy to guide whoever you have put in charge through this process to make sure, again, that your practice is being protected. And of course, make sure that there is some type of monitoring done to make sure that these general guidelines and the practice policy is being followed. Moving on with the AMA ethical opinion, physician and patient online interaction must maintain all appropriate professional boundaries. Of course, all of our associations and board rules have content to this effect as well. So personal and professional content need to be kept separate. Next, should a physician become aware of unprofessional content posted by a colleague, there are some steps to follow. First, the individual that posted the information should have this immediately brought to their attention. Unprofessional content must immediately be removed, and if it's not removed properly, the appropriate authorities need to be notified. Physicians must recognize that online actions and content can negatively impact professional reputation and medical careers. Additionally, it can undermine public trust in the medical profession. So keep that in mind, and by that, anyone who holds a professional license in healthcare or certification in healthcare, the same rule really applies. The ramifications can really be pretty unexpected and astounding, and I'll give you some examples as we get a little bit further into our presentation here. So there are some social media challenges. First, determining and adhering to those professional boundaries. This is important because social media is a newer method of communicating. The guidelines that we have in place even today really serve just as a foundation or a starting point for us. There isn't a black and white or cut and dry, plug and play type situation with social media. You really need to take these guidelines that we're going through today, establish boundaries and protocol for your practice, and implement it in a way that works the best for you, for your practice, bearing in mind all of these other guidelines and rules that we do have to follow, such as advertising rules and regulations, HIPAA, and things of that nature. More guidelines are going to be enforced, of course, as with everything else, as time progresses and additional needs are identified. And this really is going to be an ever-changing, ever-evolving situation, just simply because social media continues to grow and expand. So going back to the Federation of State Medical Board guidelines, they have some information on interacting with patients. They do discourage providers from interaction with current or past patients on personal social networking sites. So unless you have a really good reason to accept a friend request from a patient, the Federation of State Medical Boards discourages physicians from doing this simply for your own protection as well as the patient's protection. Discussion of treatment, they say that just to be reminded that social networking is not a complete form of communication. It wasn't built that way. It isn't intended that way. Certainly shouldn't be used that way. It leaves way too much room for miscommunication, misinterpretation, and again, bits and pieces of information being disseminated and shared and misconstrued across multiple different types of sites or places that you couldn't possibly even imagine in some cases. Next, possibility of misunderstood information and recommendations becomes very high with communication on social media. So this, of course, is a liability to the doctor and the practice. Also, we have the issue of crossing of state lines. Someone reads information that is shared from your state, from your practice into another state, could potentially be conflicting with the scope of practice for some provider types. So when you do, perhaps you're doing an article, you're speaking generically in a podcast or YouTube, you don't necessarily have to say the state that you're in unless it feels applicable, but just make sure that you're not making recommendations or referrals to other types of providers that may be peers to you in other states that perhaps have limitations. An excellent example of this is in chiropractic. We do have some differences in our scope of practice for many states, and also there's practices that do a lot of functional medicine, so there's different provider types within those practices. This can be difficult to explain on social media to patients or potential patients, but you certainly don't want to give the impression to anyone and everyone that may be listening that these types of procedures can be done by any and all practices that they go to. So be clear on the information that you're sharing because you can't necessarily control your audience. Next, patients are not cookie cutter patients. So of course, as we know, what works great for one patient doesn't work for all patients. So avoid that one size fits all misinterpretation. This is why I love to include on Facebook pages and even podcast, YouTube, that really for information, for patients to have the appropriate recommendations for them. Their history really needs to be collected and they need to have the appropriate evaluation by a provider that's able to perform these types of procedures that they may be interested in order to determine what's best for them. So disclaimers like that can really be helpful and avoid, or hopefully help to avoid, that misinterpretation that patients may have when they're attempting to self-diagnose. Next, it's impossible to review or discuss complete patient history and findings by social media, so certainly never recommended to do that. Going back to that patient privacy and confidentiality, this is a great concern because so often patient information, one of those patient identifiers, is recognized online that potentially identifies one or more patients by a practice. So make sure that you are complying with the HIPAA laws very strictly. Never discuss information online that can be used to identify patients. And it's recommended by the Federation of State Medical Boards to never post patient pictures. Of course, some practices like to do this, and many of you may think our patients don't mind. In the event this is your practice, you need to have the appropriate authorization from your patients. It's already been really discussed openly amongst different situations where this has come about, that patients don't necessarily understand that their pictures and information can be copied, shared, and used in other places by other organizations, that you really lose control of that once it goes onto social media sites. If your patients are fine with that, of course, again, you need to have the appropriate authorization, but by and large, they don't understand the potential risk that is to them. So it goes back to my preference, which is the same as the Federation of State Medical Boards, is just to avoid posting patient pictures online. Never refer to patients by code names or other potentially identifying titles. It's important to have a disclosure. So if patient chooses or is asked to write online or post comments on websites about experiences as a health professional, the doctor must reveal any existing conflicts of interest and be forthright about the provider credentials. Next, posting content. Be aware that information posted on social media sites can be disseminated, whether you intend to or not, to a larger audience and can be very quickly and easily taken out of context. Employees that post professional related data must also adhere to this. So we've been spending a lot of time talking about doctors and what the doctors have to do and how the practice social media needs to be managed, and we're going to spend a little bit of time on as far as employees, because that does have a little bit of a different set of rules that we need to understand so that we're not compromising employee and employer relationships and breaching any rules where that's concerned as far as social media and the right to post things and all of that sort of stuff. Employees that do post on professional sites, so on your business site, the doctor does always reserve the right to edit, modify, delete, and review internet communications by employees. This is why monitoring is really important and making sure that those professional communications are done properly. Next, let's move into our social media do's and don'ts. First, as a reminder, when something is posted online, you no longer have control. I do have a bit of redundancy through these slides, but it's just so important to remember some of these factors because this is what gets practices, providers, or employees even in trouble. So information can be dissected, linked to, forward, shared, screenshots can be taken, cell phone pictures can be taken of something that's on a computer and used in other ways. The list goes on and on. So the risk is always present. Posting pictures of patients, again, ultimately best to avoid. If it's absolutely necessary, again, go back and obtain that appropriate written authorization, making sure that you communicate to them and you get permission from them exactly what is going to be used online, why it's going to be used, and you have to make sure to communicate with them that, again, you no longer have control once it's posted. You can't control if it's dissected, linked to, forward, all of those types of things. So you have to make sure that you're making an effort to educate the patient, to let them know that even if they come to you 6 months and say, I really like that picture to be taken down, you can absolutely take it down. They absolutely have the right to request that, and you have to do so immediately. But by this time, you don't know whom else may have already copied or used that content, and there's nothing you can do about it. So you have to make sure that you are communicating that information properly. Going on with social media don'ts, don't indicate or hint at the likeliness that you are treating or have treated a specific individual. This happens sometimes with celebrities, athletes, and famous people. Absolutely can't do that. Their privacy has to be protected as well. Even if it's just a standard regular patient coming in, you shouldn't be communicating to any other patients within that facility unless you have the right to do so in writing by your patients to communicate relating treatment or identity of other patients you have. Don't post information regarding your business or the people employed by it that may be professionally harmful. Do not solicit people unless they seek you out. So you shouldn't go and try to get all of your patients to follow you by inviting them to some kind of group online or adding them to the group, but rather perhaps on your brochures, on your website. You can let patients know by signs and things in your reception area or on the phone, there's lots of ways to let patients know. You can find us online. Here we are on social media, but you can't or shouldn't be seeking them out and adding them to a group without their consent. Don't post data or make recommendations without proper disclaimers. This could be viewed and used by another individual or possibly in another state where the said recommendations are outside scope of practice. So another good reminder. Do not discuss topics that are outside your own scope of practice because this could potentially give the wrong message or wrong impression as to your own qualifications. Don't give medical treatment advice to patients or potential patients. You need to use the appropriate means of communication where you're able to privately communicate with an individual regarding their own personal symptoms or complaints. And then don't post personal data on a professional or business social networking application. You need to avoid allowing confusion between personal and professional relationships. Moving into the do's, the things that we can and we should do on social media. Do post invitations or reminders of events to your practice that you may be having or attending that you'd like your online followers to know about. Do introduce new services or products you'd like people to know about. Do introduce your team or a new employee. Just make sure that you have the appropriate authorization from those individuals to do so. Do share sales or specials that you'd like for people to know about. However, again, bounce back to that local advertising guideline to make sure that you're avoiding penalties. You have to stay compliant with your local advertising and marketing guidelines. Next, do post reminder messages, your website, how to find you online, your phone number, your blog, other ways to contact you. Do post updates in hours such as vacation or holiday closures. Do post generic bits of information that are intended to target a specific market. Again, if you like to treat athletes, perhaps you like to treat children, perhaps you like to treat families. All of those different types of things can be educated online very generically but informatively to encourage people to reach out to you for particular conditions or questions. Do use for your patient or potential patient education. So perhaps you have information on your techniques or the nutrition or products or supplies you have in your office. YouTube and podcast, again, super popular for this. Do use caution when communicating or responding to posts from patients or potential patients where the provider-patient relationship could be misinterpreted. Let's move on now and change gears just a little bit and discuss the employee use of social media. I've mentioned already that we've covered the guidelines that are in place for the practice use of social media, and even making sure that our provider and practice social media are separate and distinct from one another. However, when you implement a social media policy for your practice, your your employees do have to follow that practice social media guideline. However, employees may have their own personal social media, and they actually have the right to use that however they wish. So you want to make sure that you are towing that fine line and not dictating to your employees how to use their personal social media. So first and foremost, just a reminder, don't dictate to your employees how to use their personal social media. This is restrictive to them and definitely against the rules. However, you do need to be clear as to what, in regards to your business social media page, what is permitted and not permitted to be posted on those pages. Everyone also needs to recognize, and I think it's important to communicate with employees, and this is helpful to them as far as how to best use their own personal social media as well. Recognize that the language that we use, the demeanor that we have, the photos that we post, the opinions that we post, while they're all things that we're able to do on personal social media sites, when we post them, we repost, when we respond onto another post, should be appropriate to an entire audience. We don't know who our entire audience is in most cases on social media, so we don't know who's able to view that, and potentially the ramifications to that, again, could be dangerous to employees. So go back, do your written social media policy. Make sure that you include disciplinary repercussions for unprofessional use of social media on your business site. The reason this is important is because it could be really from one extreme to another. Perhaps there's patient identifiers that are posted to Facebook. The repercussions and disciplinary action taken from that would perhaps be different than that posting a sale or a special that doesn't start for a couple more days or that wasn't intended to be posted. So make sure that you do understand and you do include in your policy that the disciplinary action will be consistent with whatever action step was taken that was unprofessional, inappropriate, or against the policy. For employee protection, it's best to encourage your employees to not seek your patients out, friend or follow them on a personal basis. Again, this is personal protection to your employees, but also could misconstrue or misinterpret the patient-employee relationship, so having to be careful with that as well. What can and cannot be posted in relation to the workplace should be clear with employees. So an example I have for you, and there's many of them, but one example is a rough day at work, an employee goes home, mad at one or more individuals in the office. Posting frustrating remarks or opinions of coworkers should always be advised against, or their place of employment. Again, because this can come back to haunt someone. It's been the result of a lot of lost jobs over the years in many different areas of healthcare, and also difficulty in finding a new one for many of those individuals, simply because they take to social media and blast to the world opinions, frustrations of a bad day, or derogatory remarks against an employer or a coworker. So make sure you have that social media policy. Let's now look at some of the sanctions. I mentioned to you earlier that there have been some sanctions relating to healthcare and social media, and I want to give you just but a bare few of those examples because there are many out there. But here's one from November of 2012, Green Bay, Wisconsin. This particular one took place during Snapchat. So Snapchat is another social media site. It was an assisted living facility, and it became public by criminal charges that were put into place and then a news story. This particular one said that 2 workers took photos and videos of nude or partially nude elderly residents and shared them on Snapchat. One picture showed a resident vomiting, another showed a resident being assisted with an obstructed bowel, according to the criminal complaint. The employees then admitted taking the photos, sharing them with one another on Snapchat and with some friends. Both of these pled no contest to misdemeanor counts of disorderly conduct and invasion of privacy through the use of a surveillance device. An attorney for the facility told the Green Bay Press Gazette at the time the women were charged, that both were screened before they were hired, both were fired after the investigation, and then the facility has changed ownership since the incident, so there's not much more on that particular incident that at least I have at my fingertips right now. Next one, September 19th, 2017. Naval Jackson Hospital removed multiple employees, including nurses, after images of them appropriately handling newborn babies surfaced online along with inappropriate captions. The Naval Hospital reports that they have a zero-tolerance policy, and these employees have been turned over to the military and justice system. Of course, they've since lost their jobs and have had difficulty in finding new jobs. July 2010, nurse fired for an off-duty post on Facebook. So this nurse wasn't even at work. He, or I guess it was a she, was on Facebook, on her personal Facebook, tweeted that she had treated a cop killer that day, along with some other obscene comments, which this post happened to follow the shooting death of a Detroit police officer. The nurse claims that she was frustrated with having had to care for this individual, vented her frustration through Facebook. However, the hospital determined that she had breached patient privacy because this patient was now able to be easily identified. As a result, the hospital terminated the nurse upon discovery of the Facebook post. February 2013, a St. Louis OBGYN was investigated and sanctioned for making the following post on her personal Facebook. She posted this: "So I have a patient who's chosen to either no-show or be late, sometimes hours, for all of her prenatal visits, ultrasounds, and NSTs. She's now 3 hours late for her induction. May I show up late for her delivery?" That was her post. Seems pretty benign to the most of us, perhaps. However, this post resulted in a significant deal of backlash to her personally and to the hospital that she served. December 2016, a Denver health anesthesiologist who posted an unfavorable remark about Michelle Obama on Facebook elected to voluntarily resign from the hospital because her post resulted in so much backlash to herself and the Denver Health Hospital. So again, you just don't know what's happening, who's reading it, how it's being interpreted, or who might be offended. That results in numerous calls, emails, and harassment in some cases to the employers that results in having to resign. In May 2011, a Rhode Island ER doctor was reprimanded and fined by the state medical board for posting potentially identifiable information about a patient on Facebook. Which brings me to my next point here before we conclude. There are 18 protected health identifiers. I mentioned this to you at the very beginning of today's webinar. I think it's critically important that everyone know what these 18 identifiers are. Otherwise, we're not able to ensure that they're not ending up on social media or anywhere else that they're not supposed to. So for the purpose of just quickly reviewing this, I personally print out a list of the 18 identifiers and give it to every single office that asks, because you need to know what these are to make sure that you always have a way of double checking to make sure that you're not in breach of any patient privacy. But let's quickly go through these 18 identifiers. Patient's name, patient's postal address, all elements of a date except year, so their birth date, their telephone number, fax number if they have one, any email address, a URL address, which is a web address, IP addresses, a social security number, any account numbers that they have, any license numbers that they may have. So it could be a driver's license, it could be any license number that they have is identifying information, a medical record number, a health plan beneficiary number, so this is their policy number with their insurance, device identifiers and their serial number. So for example, if your patient has a TENS unit and it's got a device, wheelchairs, devices, this is one of the reasons that with DME providers, this is such a significant issue, because all of those devices have serial numbers, and this is an identifiable number to a patient. Next, VIN numbers and serial numbers. Biometric identifiers such as finger and voice prints are considered a protected health identifier. Full face photos and other comparable images, so pictures of your patients. And then it goes on to really have this all-encompassing final number 18, which is defined as any other unique identifying number, code, or characteristic, which really could be anything else. So this is their way of saying anything that could else that isn't already listed that could be identifying is considered an identifier, and this puts the practice at risk. So some examples of this for you: scars, birthmarks, tattoos, piercings, anything like that is considered another unique identifying number. I've actually seen pictures of patients' feet or arms on Facebook pages that practices have posted, and there's a tattoo or a defining mark such as a birthmark or a scar, something like that, that can identify the patient. So bear in mind those things are all identifiers. Finally, just as we conclude, I just heard this 3 or 4 days ago from an anchor on Fox News, or a contributor rather on Fox News, and she said, "I think everyone just has to come to terms day after day with the idea that everything you have done, that you say on social media, that you post, is vulnerable." Look, a lot of people have had careers ruined by sending out an errant tweet or post on Facebook that 10 years later, 5 years later, comes to haunt them. This is a brutal reminder that being awfully careful about how you engage on social media. I thought that was phenomenal, so I paused it and rewound so I could type this out for my slides for you all today. So gather all of that information, take your notes back to your team, and be discussing what to implement and how to best use your social media, making sure that you have a well-defined policy in place. I mentioned at the very beginning that I'm with the C Help Desk, and I am an on-demand virtual chiropractic assistant for coding, collections, compliance, and practice administration. So ultimately, I save you time and you money by being your certified, very well certified actually, CA that you submit the questions to. I answer your questions with the official resource, so you always know that you know, and you're not having to set things to the side to either guess or assume or increase the risk for your practice. So the C Help Desk is an on-demand virtual chiropractic assistant. Again, there's a list of my credential. I am the one who answers all of those questions. And the C Help Desk is a membership program. It's $24.95 per month, or just $269.95 per year. If you'd like to save a little bit of money, we don't do any contracts, no coaching, no upselling to anything like that. We just like to answer your questions and save your time. If you'd like to learn more, you can simply just visit the CHelpDesk.com or reach out to us at 719-301-4648. Thank you for attending, and have a wonderful week.